Symptoms can mimic a cold. You can have a runny nose, you can have fever, you can have muscle aches, but influenza is usually more an acute process. It happens more suddenly, usually in 1 to 2 days after exposure. The elderly, over 65, people with comorbidities like diabetes or asthma, young children. If you have vomiting and diarrhea and you're not able to take oral fluids, you risk dehydration, you risk electrolyte abnormalities, shortness of breath with an asthmatic or a heart disease patient, history of pneumonia. You can develop pneumonia pretty easily with influenza. So shortness of breath, dehydration, fever that won't resolve. People need to be seen by their physician or in the emergency room with those symptoms. You develop the muscle aches, the runny nose, and the nausea, vomiting, and if you have comorbidities, if you live life on the edge, so to speak, because you have diabetes or asthma or heart disease, and you're not able to, again, take fluids, or you develop a pneumonia, then pneumonia and dehydration or electrolyte abnormalities can lead to heart failure, respiratory failure, and death. And the reason you keep the hands away from the face is because it's a respiratory virus. It's spread through sneezes, coughs, and if you have your hands near your face, you're near your nose or your mouth, and you're spreading the virus that way. Vaccine is usually geared towards that year's influenza viruses that the CDC suspects is in the area. It may, make you have a few symptoms for a day or two after you get the vaccine, but it can protect you from that season's influenza virus. And again, as we noted, that the influenza virus can include death. So I say get protected, definitely.